My name is Elaine Westwick. I'm a senior physiotherapist in acute medical specialties in Inverclyde Royal Hospital. Came along here today just to learn a bit more about what is going on in the local community as regards to dementia services and what the carers are really feeling about what's available and the other stakeholders.
My name is AnneMarie Reid. I'm the Reid team lead. That's a Reablement and Enablement Services community rehab team in Inverclyde. And I'm also a community physio as well, but from the community side of things. I came here for the same reasons as Elaine was as well, just to find out a little bit more about how, well, more so from a community side of point of view, how community can support dementia care ongoing, and how all the stakeholders need to be involved, and how my team and how our service could be involved.
To me, care coordination means joined up services, and joined up not just within healthcare partnerships, but also that we're involving the patients and the carers in all the decision making and all the complex decisions that come along with the diagnosis of dementia. And really what we've been learning today is that there are things out there that we didn't know existed in the community, and that's great for us because we can help signpost people to those things so that they can get the help they need at the right time in the right place.
Care coordination for me, again, as Elaine says, is all those things plus forging closer links between our acute and community colleagues, because the journey happens across both. Someone comes from home, goes into hospital, then has to come back home again, so we have to make sure we're getting it right for the person. So it often involves communication. Maybe the IT systems don't uphold us or support as much communication as we'd like, so we kind of do a lot of face-to-face. So a lot of hard work's been done in the community and across acute just now to get those conversations started.
I think we've just been talking about this today as well, that in Inverclyde we have really good links between the acute sector and the community sector, and I think that's brilliant because we see a lot of patients coming into hospital that we know have been seen in the community, so we have those links there. We know that's what background work has been done already in the community. We can build on that in hospital, and it also helps us facilitate people home quicker from hospital because we know what's available in the community and that they're known already to the community services, or we can flag those people up who maybe have a new diagnosis to our community teams so that the support's ready waiting for them whenever they get home. I think in terms of things we could do better, we've talked about waiting times to access those services and how maybe carers can access those services just from a single point of access. I think those are great ideas today, and I'm sure lots more is going to come out of today's discussions.
The vision would be a far more responsive approach to people, especially at crisis times in their life. Also kind of a little bit more upstream, so you work with these people before it becomes a crisis as well. So just to make the service more responsive, to have a lot more joined up working, a lot more communication between different services. Eventually, kind of what we're currently doing just now is almost like anticipatory care planning without the paperwork. You know, we're trying to forge these relationships before all these mechanisms are in place actually. So it's to kind of roll with the changes, improve things and make the person's journey far better, a bit smoother, more knowing what they want to do and where they want to go, and to support families so that they can help that as well. Especially families, give family support too. So it's a very stressful situation, and I think there's a lot we can do to give that support.